At this time, we're going to remove the bursal scarring. I'm in the anterior recess right now, and we're coming out to the lateral recess. Now we're at the posterolateral corner of the humeral head in the recess. Posterolaterally, there's usually a plica back here. I like to take this plica. Now we're coming back to the posterior humeral head. There's always a pretty decent plica back here. We can start to see some of the infraspinatus muscle here. I'm going to clean this back all the way in the back. We're getting nice and clean in the back. Now I'm going to take off some of the soft tissue just to define my spur. This is done with a 4.0. And I'll take it all the way down to the end. And I just try to define my insertion site of my coracoacromial ligament, cleaning off all my soft tissue so that I can get a good visualization of my spur. Pretty decent sized spur. Once I have all of my soft tissues taken off of my subacromial lip, I'm going to take my coag and just define my elbow, just so I could see my elbow a little bit better. I know where I have to go, and that's a nice turning point, and that gives me my landmark to take my distal spur. I'll probably take anywhere between 5 and 6 millimeters depending on the size of the spur. Now we have defined my CA ligament here, distal spur, and then the beginning of my AC joint here. Now I'm going to start just on the corner. I'm using a 4.0 still. I'm going to clean up the corner first, and I'll define my margin of my spur. I'm going to keep my subdeltoid fascia, the communication between the CA ligament and the subdeltoid fascia. But I start with a 4.0, and then once I define my lip and I define my soft tissue boundary, then I'll take my 5.5 and I'll use it in a similar fashion on full radius. So now we have a pretty good margin between my subdeltoid fascia, my CA ligament, and my spur. And I'll smooth this out at the end, just at the top. Now I have my 5.5. This is going to do a majority of my work. This is actually great because this really allows me to smooth off things pretty well. Again, preserving my subdeltoid fascia. I'm pretty aggressive with this. Again, taking off about 5 or 6 millimeters. And I'm going to just keep working my way medially. Make that nice and smooth. Working my way more medial. Going to come into my AC joint in a second. You can almost see now there's that medial spur that you get on the medial aspect of the acromion and where the flare of the acromion meets. So I'm just going to make sure I take it all the way out to the side. And again, once again, preserving. Now I'm at my AC joint, so I'm preserving the joint on the back. We're just going to smooth that out a little bit. We're pretty good there now. I like that. So we got a nice smooth surface. So now we're going to take a look at the CA ligament. CA ligament attaches very closely to the subdeltoid fascia. I like to take the CA ligament a little bit further down where there's no attachment to the muscle. So I'll take it and I'll cut it down here. And I'll just take a regular biter. It's easier this way instead of chopping it up. You can see there's a little layer of fat between the CA ligament and the more anterior deltoid fibers. I'm just going to work my way like this. And we got it pretty much cut now. Now I could trim up the edges. Now I can come here and trim up the edges with a smaller 3.5 full radius blade. Now with a 3.5 full radius blade, I'm not touching the muscle. And I like to come right up to the subdeltoid fascia juncture of the CA ligament. And I'm going to just take this off. Some of these are calcified, so I like to take them when they're thickened and hypertrophic in a middle-aged athlete. And then we'll just work our way around the corner. Nice and clean once again. So now we're at the AC joint. I'm going to clean up some of the soft tissue on the outside of the AC joint. Okay, through an anterior portal, we're going to take down a little bit of the joint. I like to leave the capsule on the front and the back. I want to make some room so I could see, so I'm going to take off the fascia that's on the medial aspect of the acromion. And then I'll take some of the soft tissue within the joint itself. clean the joint first, and then I'll take my bone. Okay, so now we're going to take the anterior portion of the clavicle first, just because it's easier to get to from this portal. And I'm going to work my way around the clavicle. Again, I'm only taking about 4 or 5 millimeters off, just enough to decompress the space. A little bit more in the front here. I'm going to be right on the capsule. I'll look up a little bit now, see if I can see up there. Sometimes if I can't see, I'll take a little bit of this edge off. It just gives me a little more room. I could bevel this edge, it's not a problem. No structural purpose. Now I can remove some of this soft tissue, and then I can come back and continue my cleaning. Okay, so now I took a 5-5, just for purposes of time. Take away the end of the clavicle a little quicker. Try to smooth out the bottom a little bit. I try not to plane too much. If you got an infraclavicular spur, you got to definitely go a little bit further than you like to go without releasing the CC ligaments, and then obviously work my way around the back. The acromioclavicular joint is the tightest in the back of the joint. I'm going to just clean that up as well. I'll make sure I get a good picture of that. And we're almost there. A little soft tissue here that I will remove so I could see the back. Make sure I get all the way in the back. Really important. And we got a nice view of that as well. Okay, so the space is nice and clean now. Soft tissue space is cleaned all the way around. If I'm going to do anything, maybe just come, and they have a little bit of an infraclavicular. I'll do it from my lateral portal, but I can get it from here as well. That looks pretty good. Here we go. Nice clean space, subacromial space, AC joint. Now what I do with a whisker blade is I just come back and I'll do a little house cleaning, and I'll just clean up some of the bone off of my cuff with a little whisker blade. Whisker blade is pretty safe here. You don't actually break up the epimysium. You keep your rotator cuff pretty much intact. You could put this whisker blade right into the muscle and it doesn't suck up anything. And now you got a nice clean rotator cuff. And just real quick, a little bit of house cleaning. I'll actually take down the stump of the CA just a little bit, just so it doesn't adhere to the undersurface of the deltoid muscle. There's no residual CA ligament. I believe to take them. We're nice and smooth off of the muscle itself, where the juncture of the CA ligament met the subdeltoid fascia. We preserve the fascia, and then we obviously preserve the capsule itself regarding the AC joint. That looks nice and clean.